Hello, my name is Dale Vaughan. I'm the General Manager for the Tunbridge Wells Hospital. Interserve run the hard services for the hospital, which includes the grounds works, the help desk for the hard services, the maintenance for the M&E, and also we manage the energy, which is rather unique for this being the first single occupancy room hospital in the country, flagship for the NHS. Hospitals, different from most other maintenance contracts, have different requirements. They're 24 hours a day, you have emergencies, different systems need to be on at different times, and each one of those has a different impact on our service delivery. So therefore, whenever we do something, we've got to time very tightly with the Trust clinical staff to make sure we're not impacting on what they're doing. Between their informed client and the project company, we've developed a very close working relationship where we talk very openly about what we need to do for all three parties, so that we've got a full understanding of what's going on before we actually attempt anything.
I'm Nigel Keane, I'm the General Manager of the SPV, the project company at the Tunbridge Wells Hospital. There's a lot of requirements in terms of maintenance which is very specialised, which only occur in hospital environments, medical gases as an example. It was very important to me that we felt we had a team that we could trust to deliver those services. And Interserve have certainly demonstrated that very early, very quickly they demonstrated that. We had the right team with the right skill set to run this project smoothly. But also they understood the clinical drivers, which is so important to the Trust. They have worked very carefully and very closely with the Trust to ensure that those policies and procedures and just day-to-day requirements are met and worked with. This team here have set up and got a very, very strong relationship working very quickly. It isn't a contractor sort of client role, it's a partnership role. They understand that, both parties understand that, and they've respected that and worked with it. I think that is something which is absolutely fundamental to a successful PFI, and it's something that we've got here and got very quickly. I think the most difficult part of setting up a new contract is always mobilising a new team. We had a whole new maintenance team starting in November who were very unfamiliar with this hospital because it'd been in construction. So there was a very steep learning curve there, which they've managed to achieve in a very short period of time and develop services which are very effective, very streamlined. But in addition to that, they've maintained and developed an incredibly strong relationship with both the Trust and the SPV, which has been very important in giving a negotiating point that we can work together, but also we have been able to resolve any difficulties, any issues in an amicable way, rather than going straight through to a contractual route. It demonstrated to the Trust very clearly that they had picked the right contractor, we had got the right team in place. It demonstrated that they had thought through all of the key things that needed to be put into place to run this contract successfully.
Hi, I'm Maria Kitching. I'm the Managing Director of the Health Division of Interserve. This is a wonderful facility and I'm very proud that I've been involved and working together with our partners who are very experienced in building hospitals. You know, we looked at lots of things around the design and what was going to make a difference here for Tunbridge Wells. The team themselves have now broadened their experience, and we've been working with many of our NHS customers trying to meet the demands of the government in making cost savings, and that means working smarter.
Best thing that Interserve can bring to this contract over the 30-year period is to constantly question what we're doing and how we can improve it. Constantly look for change. Instead of shunning it, embrace it. There's better ways of doing things. There's new systems, there's new methodologies. If we can find new ways of doing things cheaper, better, faster, easier, let's do it. Moving on from that, we're also here to look after the hospital for the next 30 years. Our part in that is bringing on new staff, apprentices, so that we've got a constant flow of well-qualified, educated people.
And to conclude, Interserve have made a fantastic start on this project. We've had some superb results very quickly. We're looking forward to that relationship and that level of performance continuing.